Alright, so first one we got is sartorius. It's going to be cut and reflected. So this one's running over the quadricep muscles. So we got sartorius. The other one that's cut and reflected here is gracilis. So this is going to be an adductor of the leg. We'll talk about that after. So we got sartorius, gracilis. Go over the quads next after I show you the IT band. So iliotibial band. It's going to be this whole sheath. Second, right all along here. So it's coming from the tensor fasciae latae muscle up here. We don't need to know that, but it's coming off of that. And this whole sheath here is the iliotibial band. Right under that, we got one of our quad muscles, vastus lateralis. So anything with vastus in it is going to be one of the quad muscles, so you can remember that. Lateralis is referring to the most lateral of the quads. In the middle, we got rectus femoris. And then the one medial to that is vastus medialis. Right, so medialis is more medial, lateralis is more lateral, and then you got to remember rectus femoris is the quad that's in between those two. There's actually another quad, vastus intermedius, which is underneath rectus femoris, but it's deep to that so we can't see it. But quad obviously refers to four muscles, so that's where the fourth one is. Alright, so these guys are on the lateral side of the leg for the cat. On the medial side, or the inner leg, inner thigh, we got adductor longus at the top here. We're going to ignore this top muscle, so don't worry about that one. It's pectineus, but we're not covering it in the labs. So the first one you got to worry about is the second one down, adductor longus. The next one down is a bit bigger, it's adductor femoris. So they're both going to be adductors, as the name implies. It's right in there. The big one that's right below them at the bottom here is semimembranosus. So that's a hamstring muscle. And then you can actually see one of the other hamstrings back here poking out, but when we flip it over, it's a better view. Semitendinosus down here. So when we flip it over, we got our two other hamstrings that we're covering. Here's again semitendinosus, that you can see this last part here sticking out from the anterior view. And then the last one here that's cut and reflected is bicep femoris. Alright, so go over that a couple more times. So you got sartorius, cut and reflected, running over the quads. It's usually going to be cut right in the middle for all the cats, I think. Gracilis is the one that's cut and reflected on the inner thigh. Underneath and beside sartorius, we have iliotibial band here along the lateral side of the leg. So all that sheet right there. Underneath, we got vastus lateralis. Middle quad we can see is rectus femoris, vastus medialis, and on the inner thigh, adductor longus, adductor femoris, and semimembranosus. Once again, you can kind of see semitendinosus from here, but it's a better view from the back. You can see semitendinosus here, and then we got bicep femoris, both of these pieces. Alright, so I think easiest way to get order for the inner thigh, instead of doing adductor longus first, just because pectineus is up there too and it might be a bit confusing. You know, semimembranosus is the biggest one at the bottom here, so find that. The next one up is going to be adductor femoris, and then adductor longus is above that, and then you don't need to worry about this top one. So it's just those three in there, and then semitendinosus is poking out behind. Gracilis is on top of those if you put it down. Sartorius would be covering the quads if you had it put down. And then for the quads, I think easiest is just to remember that you have the iliotibial band here on the very lateral side of the leg. And then vastus lateralis is that one right below it. You know, rectus femoris is in the middle. And then vastus medialis is the most medial quad. Alright, so I'll do a little lesson on the skeleton for you guys. And then go over once more, and then you guys got free time for the other cats. Alright, so the first one, sartorius. So I'll just do a little lesson on the bone here so you know what I'm talking about when I say some of the parts. Just got your hip bone here. Top part of it's the ilium. Back part, which is what the bone you're sitting on. When you sit down, you feel that bone that you're sitting on, that's your ischial tuberosity. So that's right here. This whole area is ischium. And then you have your pubis area in the front here. Alright, then we got our femur, patella, and more medial, the shin bones is the tibia. That's the one you can actually feel when you're feeling your shins, and then you got your fibula more lateral, the smaller shin bone down there. Alright, so the first one, we got sartorius. It's going to originate on the anterior superior iliac spine. So it's this notch right here. There's also the anterior inferior iliac spine, which is rectus femoris is going to originate there. I'll show you that in a little bit. But first, sartorius is coming off this top one. So it's going to extend down, insert into the medial side of the tibia. So it's crossing the hip joint and the knee joint. It's going to help out with hip flexion, so bringing that hip up. Ooh, boy. Just looks on, sorry. Thought I broke it. Alright, so hip flexion, I'm not going to do that as full range. Also some knee flexion. So knee flexion is when you bring your foot back up to your butt. And it's also going to be a lateral rotator of the leg. So lateral rotations when you're rotating the leg out laterally, medial is rotating medially. Once again, hip flexion. This is going to be hip extension when your hips going back, when your legs are going back. And the other two are going to be adduction and abduction. So once again, adduction, bring it into your midline. Abducting, taking it away. So that'll be hip abduction for when I talk about the other muscles that are doing those things. Next one's gracilis. It's going to originate on the inferior ramus of the pubis. So down here, and insert on the medial side of the tibia as well. So this one, you can see when it's going to contract, it's going to pull the leg closer in towards the midline, so it's going to be an adductor, as well as a medial rotator and a knee flexor as well. So it's going to flex the knee as well as medially rotate the leg. All right, next one is iliotibial band. The tensor fasciae latae is actually originating, so it's that muscle part. You can see it on the cat here. So there's muscle up here, and then it turns into the iliotibial band. So that's the tensor fasciae latae. That's going to originate here off the iliac crest, all up here. So if you feel on your hip on yourself, you can feel where that bony protrusion is on your hip. That's the iliac crest. So it's going to originate there, turn into the IT band, or iliotibial band, run along the lateral side of the femur, and insert into the tibia as well, just on this side instead. So this one's going to abduct the leg, take it out like that, as well as laterally rotate, medially rotate, and some hip flexion as well. So it's going to help out with that motion again, and with gracilis, it's going to medially rotate the leg. Next ones are the quads. So we got vastus lateralis, vastus medialis, and rectus femoris. Vastus lateralis and medialis are only going to be knee extensors, so they're not crossing the hip joint. So knee extension is when you're straightening your lower leg out like this. And the other guy, which I showed you, is going to originate here from the anterior inferior iliac spine. It's rectus femoris, which is also crossing the hip joint, as you can see. So this one's going to help out with hip flexion. So only rectus femoris does that. The other, it's also going to help out with knee extension, but the other two only do that. They're all going to come together in the quadricep tendon, so they're all going to join into the same tendon right here, right above the knee. They're going to kind of splay over the knee and then insert to the tibial tuberosity here on the tibia. So that's why they're all going to help extend the knee when they contract. And rectus femoris is going to help out with some hip flexion as well. All right, and just for an example, so you can see they're all in the common tendon. I'm sure you've all either seen it on TV or even had it done yourself, that reflex where the doctor hits your patellar tendon here with a hammer and then the leg shoots out. So the reason why that's happening, they're all going to that same tendon. So when you hit on the tendon like that with the hammer or whatever they're hitting you with, it's actually elongating your muscles because it's pulling on that tendon. It stretches those quads out, and your mind's and your reflex as well is thinking like, "The hell's my quad doing? Like, why is it elongating? I didn't do anything." So its reaction is to contract and basically save your quad from getting stretched out too much is what it's thinking, and that's why your leg shoots up like that. Alright, so those are the quads. We'll do the adductors. We actually don't have adductor femoris in humans. We have adductor magnus, brevis, and longus. So same function though, it's going to originate from the pubic area, insert onto the medial side of the femur, and adduct. So bring that leg in towards the midline. We do have adductor longus. It's going to originate here on the pubic crest, as well as the pubic symphysis, which is where the pubic bones meet. It's got a little bit of cartilage in there. And they're going to insert on the medial condyle on the medial side of the tibia. So here as well, so as you can see when it contracts, it's going to bring that leg in. So it's going to be an adductor. And the last ones are the hamstrings. They're all going to originate in the same spot except for the short head of bicep femoris. So they're all going to originate on that ischial tuberosity, which is with that bone where you sit down on. You can feel that. Still originating here. You're going to cross the knee joint as well as the hip joint and insert onto the tibia front. So they're going to be knee flexors. So they're going to be bringing up your leg like this, as well as hip extensors, bringing your leg back. All right. So they're all going to originate here. All going to insert onto the tibia. The only exception is the short head of bicep femoris, which is going to originate on the posterior side of the femur. So it's only going to help with knee flexion. All right. Let's go over it one more time on the calf before you got free time.